phones muted during the presentation to minimize distractions, and hosts may mute you if needed. Please raise your hand during the Q&A session if you have a question. Once you're called on, please unmute yourself. Remember to mute again after your question has been answered. We are live streaming this webinar on YouTube, and it will be available on YouTube after the event. If you do not wish to be seen, please be sure your camera is turned off. Leaving your camera on indicates your agreement to be streamed in public. Webinars are offered on the third Thursday of each month at 11 a.m. New York time, and this can change according to daylight saving time. Today, we'll be having Dr. Tsegazeab Laeke. Dr. Tsegazeab Laeke completed his medical school at Addis Ababa University. He then pursued his 5-year neurosurgery postgraduate studies at this university. He's an associate professor, and his main clinical practice involves neurotrauma and neuro-oncology. He finished his PhD from the University of Bergen, and his research thesis project focused on neurotrauma care in Ethiopia, building for the future. So I welcome Dr. Tsegazeab Laeke to share his screen and give us some insights.
Thank you very much. I'd like to thank you for inviting me for this webinar. Yeah, can you see my screen?
Yes.
Yes.
Yeah. Yeah, thank you. My topic of presentation is the role of collaborations in building the neurosurgical capacity in Ethiopia. On my first part of my talk, I'll focus on collaborations in the development of neurosurgery in Ethiopia and how the neurosurgery training program is started and how it's developed. And then I will say a little bit about the current status of neurosurgery in Ethiopia with regards to service provision, research, and training. And I will also conclude my presentation by saying something about the South-to-South collaborations that we have with our partners in neighboring countries. I think most of you know about Ethiopia. Ethiopia it's the country at the Horn of Africa, and we are close to each other. Ethiopia is known as a cradle of mankind, and also as the origin of coffee. And also Ethiopia is known for its long distance runners like Haile Gebrselassie. And Ethiopia is also a source for the Blue Nile. When we come to the history of neurosurgery in Ethiopia, it's all strongly related with collaborations. And these collaborations, like in the region in Africa, started as early as 1972 when in the first meeting of the Pan-African Association of Neurological Sciences meeting was held in Kenya. Ethiopia was represented by the then neurosurgeon who was practicing in Ethiopia, Mario Manfredonia. And thereafter, as a chapter of the PANS, the Association of Neurological Sciences in Ethiopia was established in 1993. So the development of neurosurgery is strongly linked with local collaborations. And these collaborations include collaborations within the university at the department level, at the Department of Surgery. You can clearly see the first neurosurgeons on the right side, Dr. Stadios and Dr. Zennebe. Dr. Stadios finished his training in 1991 from Bristol, and Dr. Zennebe succeeded him after a year. He completed his neurosurgical training program from Cuba. And then they came back to Ethiopia and they started working at the University Hospital, which is Black Lion Hospital. By then, they were flooded with neurosurgical cases, especially emergency neurosurgical cases, and also some elective cases. So they collaborated with the Department of Surgery, and by then, residents from the surgery department were supporting their clinical practice. And then they looked out to find like partnerships to strengthen the neurosurgical practice at the hospitals, and also to start training neurosurgery in the country locally. So Dr. Zanaba was really enthusiastic to reach out to a few partners that he thought of, and this was the first letter he forwarded to the Foundation for International Education in Neurological Surgery, which really he highlighted the needs that he wants to be provided from them, like training and also some equipment donations. After like a decade, the neurosurgical training program succeeded, and it was the inception was in 2006, but the first entry surgical fellows who completed surgery joined the neurosurgical training program in 2008, and this was made possible by mobilizing partners locally, the university, and also internationally, like regionally, like the College of Surgeons of East, Central, and Southern Africa, and Fred's Korpset, which is the Peace Corps of Norway, together with the University of Bergen, and also Finns. When we started, and along many years in the training program, we had reliable partners that we are lucky to have. Those partners were coming every year, dedicating a few weeks from Auckland University Hospital. The one who started this partnership was Professor Knut, that you can see on the left up. And then Professor Morten, Ruby, and Erling are those who were coming every year, along with colleagues, to really sustain the training program in our country. And also we are lucky to have partners from Finns who voluntarily were coming so many times over the years. And the first one was John Clark and Merwin Began, Stephen Friedberg, Key Park, Timur Banerjee, Sarah Woodrow, and Andrew Kaufman. So we are lucky to have reliable partners who were coming, still supporting, consulting our training program locally. The first training centers, which are affiliated with the hospital, with the university, were the Black Lion Hospital, which is the biggest, the largest hospital in the country, which is a referral hospital, and also the Korean Hospital, which is a public hospital. So those two hospitals were the first ones to be recruited as the neurosurgical training centers in our training program in Ethiopia. But then after a few years, the Alert Trauma Center and Zodito Hospital were included as training centers affiliated with our university. When the training started, like the curriculum was adopted from the COSEXA curriculum. So this was one of the things, like we partnered with COSEXA. So there was a site visit to the hospitals by Professor Qureshi and other COSEXA delegates, and they approved the two training centers in Ethiopia, and we adopted the COSEXA training centers. We adopted the COSEXA curriculum. So these are the approved sites as COSEXA training centers. The training program is a 5 years training program. So we have 1 year general surgery training, and this is intended for our trainees, for us to get exposed to common surgical cases, because by that time, there were very few general surgeons even. So emergency cases should be covered by like polytrauma cases should be treated by neurosurgeons who will finish their training program. So this first year is intended to provide exposure to emergency and common elective general surgery cases. And the 1-year training in surgery is followed by 4 years of neurosurgery. So the 5 years have also attachments at the Department of Anesthesiology, Department of Neuroradiology, Neurology, and Plastic Surgery. So the training program is through the years, we had the opportunity to also host a few trainings from the WFNS, and this is the training which was held in Addis in 2012. Pediatrics neurosurgery training on hydrocephalus by inviting international faculties. So with for the first 8 years, we saw an exponential growth in the volume of neurosurgical procedures, and this was also witnessed in the number of graduates. So the number of graduates over the years within 10 years have increased exponentially, and currently, as of 2025, we have a total of 117 neurosurgeons who are locally trained in Ethiopia. So the training program has succeeded in ensuring sustainability. So we have now 2 more training sites, one in Addis at St. Paul's Hospital and one in the northern part of Ethiopia. So at the start, neurosurgical services were given only in the capital, Addis, but currently there are 16 cities with neurosurgical services, and this has dramatically increased access in neurosurgical services. So the chart, the figure on the left shows the number of neurosurgeons through time, and also the women neurosurgeons through the training over the years, the representation of women in neurosurgery, and also the number of neurosurgeons, which shows a good increment over the years. And also the manpower has increased, even though it's still far from adequate, but it showed good progress through the years. The most important thing is emergencies. So the access to neurosurgical emergencies have significantly improved, and the volume of surgeries, and at the same time, the quality of surgeries have improved significantly. One of the landmark events in our training and also in the country was the introduction of the microsurgery in 2006. When the university, the teaching hospital, acquired a modern microscope by the donation from our Norwegian partners. So we are now able to do more complex cases like skull-base surgeries, and these are some of the cases. And also, as in many of our countries, we have also common infectious cases like highlighted cyst, brain abscess, and tuberculosis. The other is collaborations, and as you know, like in Africa and similarly in our setup, we have a common neurotrauma patients. So these are some of the cases that we do, and also we have collaborations with NIHR Global Health Research Group on acquired brain and spine injury at Cambridge, and Downstate Global Neuroscience Initiatives, and Canadian Network for International Surgery. One of the projects that might be of importance to mention is the skills lab training that we have been trying to undertake to enable regional general neurosurgeons and residents to manage neurotrauma cases. And this like this improves the supporting task force because now we have many neurosurgeons in the region, so they are supported by general surgeons and residents. So one of the things is to teach basic emergency neurotrauma skills. So this is a course and part of a research to see how much we can train residents, general surgeons in the regions, in the districts, by a model that they can train by themselves if we provide them a digital learning platform, and then at the end they can also assess their skills by a structured skills assessment tool, and also they can also be assessed by expertise evaluation remotely. And these are some of the pilot course that we undertook. And then the other is important important milestone is in pediatrics neurosurgery in one of our teaching hospitals. A new pediatrics neurosurgery center, a center of excellence, is inaugurated, and we believe that this really uplift the pediatrics neurosurgery services, and this is supported by the generous donation of Rich Another Foundation. When we come to research, through time, we saw a significant improvement in the number of researches that are being done in neurosurgeons locally, and this graph is important to mention because through time, internal work is becoming like more and more, followed by collaborations, and this shows that there is a good progress in research activities in the country. So when we see the variety of research that are done, usually the common one is pediatric neurosurgery research activities that are like that have a good output, and also followed by neurotrauma and spine. And then the other is south-to-south collaborations. So as a COSEXA training center, we were privileged to have trainees from Uganda and Malawi, and also trainees from South Sudan who completed a 5 years training program in our training program. And also now we have also one Dr. Moses, who is being trained, who came from South Sudan. And also we have trainees and good collaboration with Somalia, who we have 2 graduated trainees from Hargeisa. And then the other is South Sudan that I mentioned. And this is really a good partnership because the Ministry of Health of Ethiopia, with collaboration with the South Sudanese Ministry of Health, have sponsored the training of 2 of our South Sudanese trainees. And also we, now that Dr. Winnie has finished, we plan to maintain and continue the partnership with South Sudan to really work together in enhancing neurosurgery in South Sudan. And then the other is in Ethiopia, Rwanda neurosurgery partnerships. We have 2 residents currently in our training program, and also there are 3 more in St. Paul's training program. And the south-to-south collaboration with Malawi is we can say that it's a south to north to south collaboration between our Norwegian partners and between our Norwegian partners and our partnership in Ethiopia, and also with Malawi. So the model is that with our good friendship and collaboration with Dr. Kane, we some of few of us will go in Malawi for like a few months to really this has a very good benefit because the setting is similar and uh,
Okay, I think Dr. Tsegazeab is having some network issues. We'll just wait for him for a few moments. Meanwhile, if you have any questions, comments, please feel free to put it in the chat area.
I'm very sorry, network connection. Yeah. So let me share my slides again. Can you see?
Yes, we can, Doctor.
Okay. Sorry. So I was saying that like we have also this what we call a triangular collaboration between partners from Norway, between our Norwegian partners and us in Ethiopia with Malawi, where we believe that it ensures sustainability because we have a collaboration between Ethiopia and Malawi, whereby neurosurgeons from Ethiopia go for a few months in Malawi to work together for some time with Dr. Kane. And this is really beneficial because the setting is similar and we share similar resources and so on. So this has been made possible by a very good partnership between the Lilongwe Institute of Orthopaedics and Neurosurgery, Kamuzu University of Health Sciences, Addis Ababa University, and University of Bergen. And these are some of the pictures. So we believe that like whenever like we have learned a few things whenever we try to collaborate, because we have to consider demands of the settings. So similar settings might have similar demands, needs, and then the other is understanding the clinical practice between our settings, and the other is standardizing practice. Once we know the settings, we might try to standardize the practice between the settings in partnership. And then the other is looking back and monitoring and evaluation of partnerships. So I thank you very much.
Thank you, Dr. Tsegazeab, for this wonderful presentation. So we welcome any questions. Okay, I see. Okay, so Dr. Marta in the chat is saying, thank you so much for this wonderful presentation. It is very impressive to see how Ethiopian neurosurgery has developed. The research graphic was very interesting. What advice would you have for other centers in African countries starting independent research without the North collaboration? How is your data collection organized, and who collects the data on day-to-day basis? Maybe we can start with that.
Yeah. Thank you very much. It's a very good question because like those are the challenges that we have. I think like collaborations are very important because they show you like importance of research and how to do it and so on. So whenever you learn from like experienced people, it makes it very simple. As to us, like we are lucky to have this mentorship mentorship whenever they come, they suggest us something, and then we try to do those things following the advices. And then the other is like I think starting small is it's a good thing. So whenever we start projects, we started with simple questionnaire development, and also utilizing our human resources like medical students and residents, and then checking the data collection every day. So like checking whenever if there are morning meetings and also rounds, we tend to really check the data quality because we first started paper-based data collection for like our research, but now like it might also be done digitally, but it's usually good to have the quality checked every day, like or frequently by utilizing the already existing infrastructure, like the morning meetings and rounds and other mortality and morbidity sessions.
Thank you so much. We have Dr. Shabani raising his hand. Dr. Shabani, please, you're welcome to ask your question.
Yeah, thank you, Professor Laeke, for a very nice presentation. Actually, I commend South-to-South collaboration, because this is the only way I can see sustainability. But I have one question. There's also this challenge of acquiring new technologies, keeping them locally and maintaining them. So how do you meet those challenges, especially with the maintenance of equipments?
Yeah. Thank you, Prof. Shaban. It's really nice to, I think one of the challenges is that like we have is maintenance of equipments. That's like one of the most important, like one of the challenging things that we have in our setting, because we have equipments, but they are not well maintained. The biomeds are not very well acquainted with how to take care of these things. So one of the things to improve in our setting is training biomeds, because we have experienced that many of our equipments were out of use because of mismanagement and also not knowing how to utilize that. And one of the things is to train our biomeds, and if it is possible, to have a dedicated biomed technicians for the equipments.
Thank you so much, Dr. Laeke. We have another question from George. He says, what is the greatest need from an equipment standpoint? How do you typically acquire what is needed? And thank you for the overview of your progress.
Yeah. Thank you very much. It's we have many needs with regards to equipment. So we have a few drills, like manual. We mostly use manual drills, but as we discussed earlier, we had the chance of getting striker drills and so on. So it's like a mishandling of those equipments, and they were not like in use. Like we used them shortly, and then they got out of use. So that's our challenge, maintaining these equipments. But with regards of equipment, I think like drills, like striker drills, and also like expanding microsurgery might be micro sets and so on. So neuronavigation is also one thing. Like the next thing is like utilizing neuronavigation and so on.
Thank Thank you so much. If I may ask about the training, if I'm not wrong, in 2006, there were like 3 neurosurgeons in Ethiopia. By 2022, I see that you had 66 neurosurgeons and 72 trainees. And currently, as you said, you have 117 neurosurgeons. So I just wanted to know this progress, was it just because of the collaborations or were there other key factors? And also, how many training centers do you have? And in the center you work, how many theaters do you have versus the number of residents? Thank
you. Yeah. So that's an important question. So so the entry is like the policy was because there are very few neurosurgeons at the start. So the policy from like the directive was to take on the upper level of with regards to the number. So in 2 years, like we had 16 and 17 entries, which is when we discuss with other people, it's like a good amount. It's a high number of trainees, and we had like 4 training centers. So the residents are dispersed in four training centers. So that's like, and that's one thing. And the volume is like another thing. So the requirement is to, like for a resident to finish, the requirement is to complete logbooks according to the COSEXA training requirement. So it's like 700 procedures. So they have to get exposed to 700 procedures. So they either have to like do the surgeries, to assist the surgeries. So they have to register their logbook, and some of the procedures they can acquire the volume in a short time, like procedures like shunt surgeries and hydrocephalus, ETVs, and also like neural tube defect surgeries and so on. And some of the procedures are difficult because we do tumors in 2 of the hospitals, and also in other training centers, also 1 or 2 hospitals. So that might be the challenge, like more complicated surgeries, but as much as possible, we maintain it to be 700. So the number of tables in our setup is like on average 6 tables per week. So like within those number of tables, they have to be exposed to the number of to the surgical volumes to graduate. Yeah. Did I answer your questions?
Yes, thank you so much.
Okay.
See, Alvin had a question. Please welcome.
Good afternoon from Liberia, and yeah, it was indeed a great presentation. And as the inaugural neurosurgeon of Liberia, I just want to ask Professor Laeke, how could we, like now, I want to, how could we from Liberia have this collaboration with Ethiopia? Because currently, I must say a very big thank you to Professor Shabani. For the first time, we have our first resident in training in the COSECA program in Tanzania. And we are really looking forward to such a collaboration with COSECA, especially regarding Liberia. Because currently we have just 2 neurosurgeons and we have some general surgeon residents who have high vein to do neurosurgery. So Professor Laeke, how could Liberia tap into this collaboration with Ethiopia? Thank you so much.
Yeah, thank you, Elvin. It's yeah. So I think it's possible to collaborate between our centers. So the first thing is like to have a simple like agreement, like mentioning that we want to collaborate, and that's an easy thing to do. And then once that's done, I think it's like our institute is willing, and they are usually willing to have that kind of collaboration. So once we do that, and maybe you like and then assessing the setting might be one thing before, like to see a few things beforehand, and then that's possible. So it's like we have a few trainees in our training site, so that's possible. So because the framework is there, we can utilize that framework.
Thank you. If anybody else has a question, please, you're welcome. Okay, I think we don't have any further questions. Once again, we'd like to thank you so much for giving this talk today. And our next talk will be by Professor Ondra Peter, which will be on the 19th of June. He'll be speaking on the building of vascular neurosurgery and skull base in Africa. Thank you so much for attending. And
thank you very much. Yeah. Thank you. Yeah. Have a
Thank you very much.
Yeah. Bye.
Bye-bye.
Bye.